Hello, I'm Dr. Steve McGraw, Chairman of Emergency Medicine at Ascension Providence Hospital's Emergency Department, Novi and Southfield. I want to take this opportunity to thank you for participating in our interview process as you consider joining our Emergency Medicine Residency Training Program. With Dr. Bunting, the Program Director, and Dr. Bishop, the Assistant Program Director, I'm very proud that you've considered interviewing with us. It makes us very hopeful for the future, and I'd like to take a quick moment to kind of explain a little bit about our two-campus system and how it will work to make certain that your training program, if you elect to come here, is one you'll be very pleased in your decision. Part of the thing that makes us somewhat of a unique program is that we actually have one hospital, but two campuses. The best way I describe it to people that practice my trade is in emergency medicine, you have sort of the urban campus with all of the attendant difficulties and challenges of working in an urban environment, and also, frankly, the considerable rewards, combined with a suburban rural campus out in Novi that also gives you the opportunity to train in a way that I wasn't afforded in my own program when I was training, to see the different side of how we can interact with our community and support them with their unique challenges and needs as well. We often think that as we're training in emergency medicine, we need to be in the place with the most trauma, the most penetrating injuries, the greatest morbidity and societal complications. And some of that does affect your training in a sense that you become very capable of working in nearly any environment. But I think an additional benefit to this one is that part of your training, a good part of it, will be at our Novi campus, which, if you're not familiar with Michigan, is northwest of the city of Detroit and is certainly more rural and suburban than our Southfield campus. Both these two departments, really one hospital with two campuses, combined to see over 120,000 annual emergency department visits. Both are level 2 trauma centers. Our Novi campus is a comprehensive stroke center, and we're very proud of the fact that the Southfield campus, while not designated as a comprehensive stroke center, still does interventional neuroendovascular procedures. You will be joining an amazing collection of fellows and residents in our residency training programs and fellowships. I'm very proud that our campus at both sites has really supported those training programs historically and will do so into the future. What I really love about emergency medicine training at both campuses, however, is you'll have the support of the faculty that work with you and your core faculty, as well as all of the adult attending physicians like myself and my partners that will make certain your experiences in training are supported. You'll be able to see the most ill and injured folks you can imagine, knowing that you have a very competent, board-certified and residency-trained physician ready to help you be successful. Make certain that you have what you need to be successful, protect you in your learning, and give you the opportunity to ask questions and feel confident in the decisions you're making as you train to take care of those that are so sick and injured. I'm very grateful that you've considered in applying to our program. The application, of course, starts, but really the interview process for me is where it kind of begins. As a non-core faculty attending physician, this is the part I feel that I have really the most oversight and the most participation in. And I'm very pleased to have you here today interviewing with our core faculty members. As you get to know them during the interview process, realize also that, like the regular attending faculty, your core faculty members are absolutely dedicated to your learning, your support, and your success. At the end of 3 years, we want you to be so accomplished as an emergency physician that you would even consider joining our own group or a group like ours, one committed to taking care of the patients by taking care of the providers that do that. I'm very proud of my company, Independent Emergency Physicians, as we are all democratic partners in it, but I think that lends a sense of collaboration, support, and friendliness that will be very, very good for you as a training program and for physicians from which to learn. I will be glad to answer any questions you may have outside of this process once your interview is complete. I'm easy to get a hold of. My email is steven.mcgraw, M-C-G-R-A-W, steven.mcgraw@ascension.org. I'd happily answer any questions you may have. I will make certain that you understand that when we look at how we want to provide that training, it's all in. From the administration of these two campuses in our hospital to the rotations you'll be on, including OB, surgery, medicine, critical care, pediatrics, intensive care medicine. There won't be an operative time where you'll feel abandoned or not supervised adequately or just forced to do the work. You're going to learn how to manage these patients in different specialties, and you'll bring all that good knowledge and capability back to the emergency department, where you'll work with us to put it into action. On behalf of the faculty, the attending physician staff, our nursing leadership, and our nurses in our department, once again, I want to thank you for your interest in our program. Please reach out to me if you have any questions, and I look forward to meeting you in person one day soon. Thank you.